The risks associated with massive weight loss procedures depend on what we're actually undertaking. In general, like any other operation, there can be problems when it comes to collections of blood or a haematoma. A high drain output can be a sign that this is occurring. There can be issues with fluid otherwise. Infection is a potential thing that we have to deal with, and other issues in relation to system effects, blood clots in the legs, for example, other things with effects on breathing can be things that we're looking out for and trying to minimise any harm from. Specifically, you might notice that there are issues with numbness in the site that I've operated on. The whole area can feel really different as well. And depending on whether that be the tummy, the arms, the legs, back, any of those particular zones, there can be changes that you're well aware of from the word go. As the days go on with your recovery, swelling becomes a bit of a concern, and that's what your pressure garments are there to try and help with. And of course the drains, if required, are there to try and take any extra fluid away as well. The weeks will go on, and the tapes and the things that I have in place to try and help you heal will start to be removed by the nursing staff that we have in our practice. And it's at that point that we start to actually look at your wounds and see how you're healing. And along the way, I'm checking on, is it right? Is it wrong? Are there problems with your scarring? Is there anything extra that we need to do to get you right? Through all of this, we're also looking at your mobility and recovery and giving you advice on what best to do so that you don't cause any extra pain or any harm to the internal repairs that I may have done. Long-term follow-up is necessary, and me following you out for 6 to 12 months, something beyond that, is really important in massive weight loss. The skin itself has been stretched up before, and I take out stuff that we want to get rid of, but what I'm stitching together has often been stretched itself, and there can be recurrent laxity that develops that needs a few tidy-up procedures to make neat again. So part of the follow-up is looking for that and being open to the need for further surgery just to get that result that we're both chasing.